I'm back. Hey everybody, Dr. Danielle Ward here, and I'm excited to give everybody my first update as a fourth year plastic surgery resident. Yes, you heard that right. I am now fourth year. My last update post was at the end of my third year, so I have so much to catch you all up on, but I'm excited to be here and talk to you, so let's get to it. Before I begin, I just want to say I appreciate all the calls, texts, messages this week. Hurricane Milton was very devastating for Florida. As most of you know, I am in Miami. Fortunately, we were not affected too much by the hurricane. We had the wind, a little rain, but nothing like our people up north near Tampa, Orlando, those areas that got hit twice by two separate hurricanes within like a week apart. So my thoughts and prayers go out to anyone affected by it. But fortunately, I was not affected, but I do thank you for checking up on me. All right, now for updates. So fourth year plastic surgery resident. First, our rotations begin in July. We start our new year in July of every year. And this July, I was actually on vascular surgery. So typically this is something that's done within the first 1 to 2 years of a plastic surgery residency program. Like I said, when we started, we are a new program, so we're constantly, remembering things that we need to add. And vascular surgery, like having a set rotation in that, was something we were lacking in, so this was added. Fortunately, I've had a lot of vascular surgery experience though. In my time as a plastic surgery resident, we took a lot of vascular call within our first 2 years. So it was something I was really comfortable with, but it was nice, going to their clinic and seeing how it worked, and then being in on vascular procedures again, because I think, my last angiograms and all that were as an intern. But it was nice to have a formal rotation in it. And then to kick off our new academic year, we did have our journal club at Topgolf. It was sponsored by Polynovo. That was a really nice experience to just learn. One of our attendings gave a great presentation on wounds and reconstruction, and then we were able to eat and golf and get together as a residency program after, so that was really fun. And then for the rest of July, I think it was just a pretty smooth month. It wasn't too bad. Being on vascular actually gave me some time to study, which is always a good thing. I am back into my plastic surgery, eat, sleep, breathe plastic surgery mode, currently more so than back in July. But July was a great month for studying. Now, as for August and September, I'm not even gonna lie, these months were a complete whirlwind, a bit of a blur in my head, so much going on, but I will try my best to recap that as much as possible, quickly of course. So August, September, same rotation. It's a combination, so it's microsurgery, general reconstructive surgery, aesthetic surgery, and gender affirmation surgery. So a lot going on there. We cover a lot of hospitals, we do a lot of cases. It is a non-stop rotation, and I was fortunate to have 2 months of it. It's actually one of my favorite rotations because we do get to do so much and learn so much, but time was very limited. So I've essentially been under a rock for the past 2 months. But just to recap, we had some great cases. I love doing like phalloplasties and vaginoplasties. These are part of gender affirming care. So that's the male to female transition and female to male transition. The procedures themselves are so intricate, and the work is just mind-blowingly amazing. It's something that I love, I'm passionate about. And I remember back in August, I think that like the first or second week we had a phalloplasty, and this is the reconstruction of going from female to male, and this procedure took us 16 hours. Lots of microscope work because you're doing a radial forearm free flap, and then you're connecting those vessels to the groin area. You're doing that under the microscope, and that is, for me, still a humbling experience where you have to, work on your hands, and you're working with sutures that, a 9-0 suture is like smaller than a strand of hair. And so you're working with these very small vessels under a microscope, trying not to shake your way through it or, overturn the vessels. So, I love those procedures. They're super fun, super complex. They make you think, and it's something you have to study for. So even though the past 2 months have been like a whirlwind and very busy, I've actually been studying and learning and growing a lot as both a physician and a surgeon. And then I still made time for self-care. So in August, I did make a quick trip to Atlanta to see my friend and celebrate her birthday. So that was, a good little weekend vibe. But for September was a bit rough. I was still working, but in September I was speaking at the Osteopathic National Conference, so that's OMED 2024, that took place the third to last week of September. And then after that was the plastic surgery meeting. So for me, I don't get a lot of time off. In residency, you get 1 day off for every 7 works, so that equates to 4 days off in an entire month. And when I'm on my microsurgery recon rotations, we're not allowed, to take like vacation time off. So I had to be strategic, which meant that I was essentially on call from like the end of August until September 15th. And then my first official day off was, I believe, like September 21st. And that day I was flying to San Antonio to speak at OMED, which was a truly great experience. It was my first time attending the Osteopathic Medical Education Conference in person. I had originally attended, I think it was 2021. I did it virtually, so I was part of a panel, but I never been around all the DOs in person, so that was great. I was invited to be a keynote speaker for the medical student session, which took place that Sunday. So I did fly in that Saturday. I got there early enough to see the 2 other keynote speakers, which were Montel Williams, who is a talk show host that I grew up with, so that was super cool experience for me. And then Dr. Kevin O'Connor, who is a fellow DO, but he is also the chief physician to the White House and to the United States president, and has been the longest serving White House president since, I believe, like the Bush administration. So it was really cool and inspiring to get a chance to see them talk. Also, I enjoyed the conference. They had things like a puppy station where I got to like pet some puppies in the exhibit hall. I got to make a Texas luggage tag. I was able to go to the receptions and connect with some of my PCLM family and other fellow DOs who I hadn't seen in a while. So that was a super amazing experience. And then my talk was Sunday. So it was nice being able to speak with the students. As a keynote speaker, I said it was my first time as a keynote speaker, but I do believe I might have given a keynote talk once before in life. But I think this was my first time really flying out and, being at a major conference as a keynote speaker. So it was a special moment for me. I was in Texas like 24 hours, but after my talk, I was able to go get some tacos. I walked to the Alamo, took a quick picture there, and then I essentially went to the airport and made it back to Miami. I believe I was delayed, so I think I made it back to Miami at like 1 in the morning, went to bed at 2 a.m. Luckily, I lived close to the airport, and then I was back at work, I think in a case like 7, 8 a.m. So super busy. And then I worked 7, 8 a.m. I was in didactics, and then we had cases after, because every Monday we have didactics from 7 to 11 in the morning. But then after that I was at work. So that Monday, that Tuesday I was at work. Wednesday morning I still had to round on my patients, and I believe the day before or the week before we had a vaginoplasty. So I had to go around on that patient, make sure that that patient was doing okay. I was rounding at like 5 in the morning. But I told all the patients before that I'd be rounding super early. And then after that, I went back to the airport and I flew to San Diego and I attended the plastic surgery meeting. And that is going to have to be a post video all on its own because that was just so phenomenal. So stay tuned for that. I'll record that right after this video and probably post it in a few days just to give everybody an update on that. And then now we're into October. And this month is my oral maxillofacial month. So lots of teeth and face things. It's a really great month. This is actually a subject that I'm like not so great in. Also, I just don't like teeth. I'll be honest with you guys. Like the whole extracting teeth is like but it's actually really cool for me to be involved in these cases. I would love to do like a Lefort osteotomy. I have not done that yet. Well, like a Lefort 2 or 3, which involves like you're breaking facial bones and readjusting it. So hoping I get a chance to do that this month. But cool cases. I think yesterday we had a bilateral eyebrow lift. Also did a neck lift on a patient. So that was really cool and interesting, getting to see the planes and being involved in that. And yeah, like lip cases. I'm still learning like the angles. So like there's the cephalometric angles. I'm sure I probably said that wrong, but like you have your S and A, S and D, and then there's certain angles we have to know about, like where your positioning is. So that's what I'm absorbing myself into this month. It's not as intense as the past few months have been. So I'm really taking this time to study because our annual in-service exam is coming up in March. And I know that my good study months are going to be now through December, whereas January, February, March, I'm actually on some intense rotations. So when I'm not working right now, I am essentially doing questions. I'm in the resident education modules. I am like just truly trying to get this down because I want to increase my in-service score and do really, really well, especially now that I'm a 4th year. And for our in-service, we're judged against everyone in the nation taking the exam. So it's not like you could score 70% and be good. You know, if you score 70 and everyone scores a 90%, that might be failing for you. So it's just really important for me to do well in that regard. But other than that, as for October, well, speaking wise, I did get a chance to speak to the students at the University of Miami last week. So that was great, speaking to the SNMA panel. And then this morning, I was involved in the Flexus Symposium, speaking to medical students and pre-medical students interested in plastic surgery. So that's why I'm dressed up and decided to make the YouTube video. But other than that, things are going great. I'm just really embracing my time as a budding plastic surgeon. I am like immersing myself in the field. I'm getting to know people. I truly, truly love it. And it's exciting to know that, you know, I have 2 years and like 9 months to go before graduation, but it's also scary too. But other than that, like, if you guys have anything you want to see, let me know, because this will be the time for me to make videos. Because once it hits January, you won't hear from me probably again. But I just wanted to give everybody a quick update on what I've been doing. If you like what you see, please subscribe. And also, can I just take some time to, like, does anyone else dress up for Zoom sessions? Because, you know, that's what I just came out of, so that's why I'm dressed up. But, you know, I don't just put on the shirt, I also do the pants. But I'm also just, like, loving how skinny I'm looking. And then also, this shirt is on backwards because it's way too low, but I'm kind of liking the look. I might utilize this at conferences with a jacket, but I know that's random. So I hope everybody has a wonderful Saturday, wonderful month of October, and until next time, bye guys.